There's something nobody has ever told you about that ordinary symptom you wake up with every single morning. That dryness in your mouth, that tongue that feels glued to your palate before you even reach for your first glass of water. That sensation you've been normalizing for months, maybe years, because after all, that's just what getting older means. Well, what I'm going to share with you today goes against everything you've probably been led to believe. Morning dry mouth is not a hydration problem, it is not a quirk of the body, and it is definitely not something that happens to everyone simply because they're aging. When this symptom becomes a constant presence, your body is not asking for a glass of water. It is sending you a message about what is happening on the inside, in your heart, in your pancreas, in your immune system, and yes, in your brain as well. Studies published in the Journal of Dental Research and the International Journal of Oral Science have spent years documenting the direct link between chronic oral dryness and cardiovascular disease, type 2 diabetes, early cognitive decline, and autoimmune disorders. How many doctors have explained it to you this clearly during an appointment? I think I already know the answer. That is exactly why I'm here today. Today we are going to cover the 7 reasons why you wake up with a dry mouth. We'll go from number 7 down to number 1, from the most common cause to the one that could change the course of your health if you don't know about it yet. And I want to make you a promise before we begin. By the end of this video, I'm going to reveal the number 1 cause, the most widespread, the most damaging, the one that conventional medicine almost never mentions openly because it's too uncomfortable to point out. And I'll give you a hint right now. That cause is not in any restaurant or any doctor's office. It's in your own home, in your medicine cabinet. In all likelihood, it's something you or someone you love is taking every single day without knowing what it's actually doing to the body from the inside. Stay until the end because once you find out, you'll never look at it the same way again. I'm Dr. Adam Smith, and here at Virtual Health we are dedicated to giving you the kind of medical information you actually deserve to have. Over the course of my career, I have worked with thousands of patients over the age of 60, many of whom came to me after years of being dismissed, minimized, or worse, sent home with the words, "You're just getting older." That phrase infuriates me, and I want it to infuriate you too, because aging is not the same thing as getting sick. Aging does not mean giving up. A body that ages well, with the right information and the right care, can function in extraordinary ways for decades more. I've seen it happen over and over again. Now, to understand why dry mouth is such an important signal, you need to know something about saliva that you were probably never taught. Saliva is not simply water, it is a complex biological fluid. It contains digestive enzymes, antimicrobial proteins, electrolytes, growth factors, and antibodies. Under normal conditions, your mouth produces between 1/2 liter and 1.5 liters of saliva every day. That constant flow doesn't just help you chew and swallow, it also protects your teeth from decay, regulates the bacterial balance in your mouth, enables smooth speech, and acts as a first line of immune defense. When that flow is compromised, everything else suffers along with it. Real physiological changes do occur with age. The salivary glands lose some efficiency, the oral mucosa becomes thinner, and the thirst threshold rises, which means many older adults don't feel thirsty even when they're dehydrated. But I want you to understand this clearly. Those natural changes of aging represent only a small part of the problem. The vast majority of chronic dry mouth cases have identifiable, treatable, and in many instances, completely reversible causes. Before we continue, a quick question. How long have you been noticing this symptom when you wake up? Days, months, years? Drop it in the comments. It takes less than 30 seconds and it genuinely helps me understand what's happening across this community. Write it while we keep going. Let's start with the most frequent cause and also the most underestimated one. While we sleep, the body enters a state of deep relaxation that includes the jaw, the tongue, and the muscles of the throat. In many people, especially after age 60, the tendency to breathe through the mouth during sleep increases noticeably. The tissues of the pharynx relax more. The nasal septum may be partially obstructed without us noticing during the day, and our sleeping position can leave the mouth slightly open for hours without us being aware of it. The result is predictable. Air continuously passing through the mouth evaporates moisture from the mucous membranes, and that cardboard tongue feeling you wake up with is the direct consequence. But there is one factor that very few people consider: the environment in the bedroom. If you live in a dry climate, if you run heating or air conditioning all night, or if you sleep with a fan pointed directly at your face, you are amplifying that drying effect. The relative humidity in rooms with active heating can drop below 30%, when the optimal range for mucous membrane health sits between 40% and 60%. Pro tip: an ultrasonic humidifier placed about 5 feet from the bed can transform your sleep quality and eliminate morning dry mouth within a few days if this is the main cause. You don't need an expensive model. There are perfectly good ones for under $30 that get the job done. Also, if you suspect you breathe through your mouth while sleeping, nasal adhesive strips, the same ones athletes use, are inexpensive, safe, and help many people from the very first night. Cause 6 has to do with something that may well be part of your daily routine without you having noticed the quiet damage it causes. Alcohol, caffeine, and refined sugars consumed at night. Let me be direct with you. If you have a glass of wine, a beer, or any other alcoholic drink with dinner or before bed, that drink you think helps you unwind is one of the most direct reasons you wake up with a parched mouth, a slightly elevated heart rate, and maybe a mild heaviness in your head. Alcohol is a powerful diuretic. It causes the kidneys to excrete more water than you are taking in. After age 60, this effect is amplified because the kidneys gradually lose their ability to concentrate urine. So alcohol produces a double dehydration. And there's something else. Alcohol blocks the antidiuretic hormone, ADH, which is precisely the hormone that tells the kidneys to retain water overnight. Without it, you keep losing fluids while you sleep. Caffeine works in a similar way. Many of my patients tell me they don't drink coffee at night, but they do have tea, hot chocolate, or cola drinks. All of these contain caffeine, and in older adults whose livers metabolize substances more slowly, the half-life of caffeine can stretch to 8 or 10 hours. The tea you had at 6 in the evening is still in your bloodstream at 2 in the morning. Refined sugars, for their part, trigger a blood glucose spike that the body tries to compensate for by drawing water into the bloodstream, dehydrating tissues from the inside, including the mucous membrane of your mouth. Practical tip and a home remedy you can start tonight. Set a 3-hour rule before bed. No alcohol, no caffeine, and no sweets or simple carbohydrates. Replace them with something I genuinely recommend: warm water with the juice of half a freshly squeezed lemon. Why does lemon work? Because its acidic flavor is one of the most powerful activators of the salivary glands. Within seconds, it reflexively stimulates saliva production. And although lemon tastes acidic in the mouth, once metabolized, it has an alkalizing effect on the body, which helps maintain a healthy oral pH and slows the growth of the bacteria responsible for that pasty morning breath. Drink it warm, without sugar, 30 minutes before going to bed. You'll notice the difference from the very first night. We arrive at cause 5, and this is the one I find most rewarding to explain because it is the most overlooked in conventional medical practice. The body requires certain micronutrients to sustain saliva production, the integrity of the oral mucosa, and the proper function of the nervous system that regulates the salivary glands. When these nutrients are deficient, dry mouth is often one of the first warning signals. The first is zinc. This mineral is essential for maintaining the mucous membranes and for the enzymes that make up saliva. The problem is that zinc is not stored in the body the way calcium or iron are. You need to take it in consistently, and after age 60, intestinal absorption drops because gastric acidity decreases and the intestinal transporters for zinc become less efficient. Where to find it? Pumpkin seeds, shellfish, especially oysters, lean beef, chickpeas and lentils. The second is vitamin A in its preformed retinol form, found in beef liver, egg yolk, and whole dairy products. Vitamin A is essential for the renewal of the epithelial cells that line the mouth and throat. Without it, those cells flatten, dry out, and lose their ability to retain moisture. The third is the B complex, especially vitamin B12. B12 deficiency in people over 60 is alarmingly common. It is estimated to affect between 10% and 30% of this population, because its absorption requires a protein called intrinsic factor, which the stomach produces in decreasing amounts as we age. An inflamed tongue, burning in the mouth, slow-healing mouth sores, and dry mouth are classic symptoms of this deficiency. If you suspect a B12 deficiency, ask for a blood test to confirm it. And if it is confirmed, the most effective supplement is sublingual methylcobalamin, a small tablet that dissolves under the tongue and is absorbed directly without passing through the digestive tract, which is precisely what's failing. Cause 4 is where the body begins to speak about something deeper, something that, if not caught in time, can radically alter the course of your health. Blood sugar dysregulation and prediabetes. Listen closely to this because it matters. Excessive thirst, including that morning dry mouth, is one of the cardinal symptoms of diabetes and prediabetes. When blood glucose levels remain chronically elevated, the body attempts to eliminate that excess through the urine. That process generates a massive loss of water that dehydrates tissues from the inside out. The salivary glands are no exception. What concerns me most is this. Prediabetes in people over 60 is very often completely silent for years. It causes no pain, no obvious signal, just small whispers. Getting up in the night to urinate, waking up with a dry mouth, feeling somewhat fatigued after meals, those small energy dips in the mid-afternoon. Let me tell you about Carol. She was 67 years old when she came to see me. Her previous doctor had reviewed her labs 6 months earlier, and everything had appeared within normal range. But Carol had been waking up with a dry mouth for nearly a year, getting up to drink water in the middle of the night, and feeling heaviness in her legs every morning. Her family attributed it to the summer heat. Her previous doctor told her it was age. The first thing I did was order a glycated hemoglobin A1C. The result? 6.1%. Technically pre-diabetic. Her fasting glucose? 118 milligrams per deciliter. With that early diagnosis, Carol did not need medication. We made specific dietary adjustments, incorporated 30 minutes of walking after meals, and added berberine and magnesium bisglycinate as metabolic support. 6 months later, her A1C had dropped to 5.6%. The dry mouth disappeared completely, and Carol said something to me I haven't forgotten. "Doctor, I feel like I'm 55 again." That is what early detection means. If you have dry mouth in the morning, wake up at night to use the bathroom, feel fatigued after eating, or notice unexplained itching on your skin, ask your doctor for a glycated hemoglobin A1C at your next blood draw. It's a simple, affordable test that gives you a picture of how your blood sugar has been behaving over the last 3 months. Not a single fasting glucose reading that can vary from day to day. The A1C. That is the name you need to ask for. Cause 3 is the one my patients thank me most for revealing, because it is a condition that hides behind vague symptoms for years, sometimes decades. Sjogren's syndrome is an autoimmune disease in which the immune system mistakenly attacks the body's own exocrine glands. The primary targets are the salivary glands and the lacrimal glands. The result? A mouth that doesn't produce enough saliva and eyes that don't produce enough tears. This syndrome affects women after menopause disproportionately, although it also occurs in men. It is estimated that between 1% and 4% of the population over 50 has it, and the vast majority are undiagnosed. Why? The answer is frustrating. Its symptoms are exactly what doctors tend to attribute to normal aging: dry mouth, irritated eyes, fatigue, diffuse joint pain, difficulty swallowing solid foods. Oh, your body just isn't what it used to be. Well, that's just part of getting older. No, that is not age. That is an autoimmune disease with a name, a diagnosis, and a treatment. Here is the power I want to put in your hands today. If you have chronic dry mouth combined with dry eyes, fatigue that doesn't improve with rest, and difficulty swallowing demand these specific tests. Write them on a piece of paper and bring it to your appointment. ANA, antibodies, also called anti-nuclear antibodies. Anti-SSA/RO and anti-SSB/LA antibodies, which are specific markers for Sjögren's syndrome. And the Schirmer test to evaluate tear production. Do not leave the office without asking for them by their exact name. Anti-SSA/RO and anti-SSB/LA. Those are the antibodies that can give you a definitive answer after years of confusion. Sjögren's syndrome has no cure, but it can be managed very effectively. Saliva substitutes, oral pilocarpine, dietary adaptations, and in some cases immunomodulators can completely transform a person's quality of life. We are approaching the end. Cause 2 requires the most care to explain because it touches a deep fear that many of us carry without saying out loud. Neurological changes and early cognitive decline. I want you to listen to this calmly. What I'm about to tell you is not here to frighten you. It is here to give you tools. The salivary glands are regulated primarily by the parasympathetic nervous system through the facial nerve and the glossopharyngeal nerve. When this system begins to lose efficiency, one of the first manifestations can be a reduction in saliva production. Research from the Karolinska Institute in Sweden has identified oral dryness as a possible early marker of autonomic nervous system decline. Conditions such as Parkinson's disease in its initial stages, mild cognitive impairment, known as MCI, and some early forms of dementia can begin manifesting in ways as subtle as slight changes in swallowing, barely perceptible shifts in speech, and yes, persistent morning dry mouth. Let me tell you about Robert. He was 71, retired but active. He played dominoes with his friends 3 times a week. He came to me because his wife had noticed that lately he was struggling more to find the right words when he spoke, that his handwriting had become smaller and more cramped, and that he constantly complained of waking up with a dry mouth. He attributed it to the stress of no longer being in the workforce. I performed a complete neurological evaluation and a basic cognitive battery. The results showed early signs consistent with very early-stage Parkinson's disease and a mild associated cognitive decline. And do you know what happened thanks to that early diagnosis? Robert was able to begin a neuroprotection protocol that included moderate to high-intensity aerobic exercise, the only factor scientifically proven to slow the progression of Parkinson's, intensive cognitive stimulation, and supplementation with coenzyme Q10, magnesium glycerophosphate, and certain polyphenols such as curcumin and resveratrol. 2 years later, Robert is still playing dominoes. His wife says he even wins more often now. The decline has largely stabilized. His quality of life is full. Early detection doesn't give you back the years that have passed, but it can give you many more good years ahead. If alongside dry mouth you are also noticing any of the following: stiffness when you get up in the morning, loss of smell in recent years, difficulty swallowing, small tremors when holding objects, or a change in your handwriting, talk to your doctor. Ask for a neurological evaluation, not as a cause for alarm, but as an act of self-care. And we have arrived at cause number 1. I told you it was in your home, in your medicine cabinet. The most common, most damaging and most underreported cause of chronic dry mouth in adults over 60 is polypharmacy, the medications you take every day. There are more than 400 documented medications that list dry mouth as a side effect. 400. And the most frequent ones are not rare drugs. They are the ones millions of older adults take every morning with a glass of water, without knowing the invisible price they are paying. Diuretics used for high blood pressure or heart failure increase the excretion of water and sodium, dehydrating tissues including the salivary glands. Antihistamines, even the over-the-counter ones for allergies or sleep, have a potent anticholinergic effect. They block acetylcholine, which is precisely the neurotransmitter that tells the salivary glands to produce saliva. The effect is direct and immediate. Dry mouth is not a rare reaction, It is the medication's mechanism of action working exactly where we don't want it to. Antidepressants, especially SSR, is like escitalopram or sertraline, and tricyclics like amitriptyline also carry significant anticholinergic load. The same applies to beta blockers for the heart, medications for overactive bladder such as oxybutynin, antihypertensives like clonidine, bronchodilators for asthma or COPD, and certain drugs for osteoporosis or gastroesophageal reflux. Many of my patients over 60 take between 4 and 8 different medications a day, and none of those drugs were prescribed with consideration for how they interact with each other in terms of total accumulated anticholinergic burden. The effect is not additive, it is multiplicative. Each anticholinergic medication added to another amplifies the damage to the salivary glands. But there is something doctors rarely say out loud that you deserve to know. That accumulated anticholinergic burden is directly associated with a higher risk of cognitive decline, falls, confusion, and episodes of delirium in older adults. This is not a minor side effect, it is a real, documented risk. This does not mean you should stop taking your medications. Never make that decision without medical supervision. But it does mean you have the right and the responsibility to ask. At your next appointment, say this in these exact words. Doctor, I'd like you to evaluate my total anticholinergic burden. I need to know whether any of these medications may be contributing to my dry mouth and my cognitive risk. Total anticholinergic burden. That is the technical term. Save it in your phone right now, because your doctor may have never reviewed it in the context of all your medications together, and there may be equally effective alternatives with a far more favorable profile. You can only access those alternatives if you ask the right question. Now that you know all 7 causes, I want to give you something concrete. 5 real steps you can begin today. Step 1. Tonight. Warm water with lemon. Half a glass at room temperature with the juice of half a small lemon, no sugar, 30 minutes before bed. It activates the salivary glands, alkalizes the oral environment, and reduces the bacteria that cause that pasty morning breath. Simple, free, and effective from day 1. Combine it with a gentle rinse using room temperature water when you wake up, before eating or drinking anything, to rehydrate the mucosa from the very first moment of the day. Step 2. This week. Keep a 7-day log. Each morning, write down on a scale of 1 to 10 how dry your mouth feels. Note whether the previous night you drank alcohol, whether you had the heat running, whether you took an antihistamine or a sleep aid. That 1-week log is worth its weight in gold at any medical appointment. It tells a story that an isolated symptom simply cannot. Step 3. This week. Put together your complete medication list, everything without exception. Prescription and over-the-counter, supplements, sleep aids, antacids, syrups, all of it. Bring it to your next visit and ask by that exact term for an evaluation of your total anticholinergic burden. Step 4. At your next blood draw, request these tests by name. Glycated hemoglobin A1C to rule out prediabetes, serum vitamin B12 and folate, serum zinc. If you also have dry eyes, add ANA antibodies and anti-SSA/RO. Those 4 groups of parameters will cover causes 5, 4, and 3 from what we've discussed today. Step 5, also tonight. Optimize your bedroom. Place a glass of water on the nightstand, not to drink all at once if you wake up, but for a small sip to rehydrate the mucosa if needed. If you have heating, crack the window slightly or place a bowl of water near the radiator. And if dry mouth is an ongoing problem, a low-cost ultrasonic humidifier may be one of the best investments you make in your sleep quality this winter. I want to close this video with something I truly believe. Your body is not complaining without reason. It is not manufacturing symptoms to inconvenience you, and it is not aging in some inevitable, irreversible way. Your body is an extraordinarily intelligent system that has been taking care of you for decades, and now, through signals like dry mouth, it is asking you to return that attention. You are not broken. You are not condemned to feel this way. You are simply missing information, and now you have it. If you are a caregiver for a parent, a family member, or a friend over 60 who complains about this symptom every morning, share this video with them right now, literally right now, before you keep scrolling. It could be the information that changes the direction of their health. And if you are the one waking up with a dry mouth, I'm asking just one thing from you. Choose one of the 5 steps from today, just one. The lemon water tonight, the medication list this week, the blood work next month. A single step is enough to start moving things in the right direction. If this video gave you something you didn't know before, hit the like button. It takes 2 seconds, and it tells the algorithm that this kind of content deserves to reach more older adults who need it. Subscribe if you want to keep receiving honest medical information, without condescension and without miracle cures being pushed on you. And share this video with someone your age or your parents' age. And before you go, tell me in the comments which of the 7 causes surprised you the most. Was it the polypharmacy, Sjögren's syndrome, the neurological connection, or maybe the alcohol and caffeine link that nobody ever connects to dry mouth? I read every comment. This is not just a YouTube channel. It is a community of people who refuse to accept that growing older means giving up. The information in this video is educational and general in nature. It does not replace a consultation with your doctor and does not constitute a medical diagnosis. Every person is different, and any change to your treatment, supplementation, or lifestyle should always be discussed with a healthcare professional who knows your individual case. We give you information here so you can arrive better prepared for that conversation, not to replace it.